All right, let's move on to ADHD and fMRI scans or functional MRI scans. It's compared to regular scan, which is structural. All right, so what is an fMRI? It stands for Functional Nuclear Magnetic Resonance Imaging, works through a combination of radio waves and magnets. Engineers have figured out how to magnetize soft tissues, such as brain, very precisely. When you send radio waves through those magnetized tissues, the magnetic field changes the radio wave. Sensors detect even minimal changes in the radio waves to form a 3D image of the scanned tissue. The only limits on how fine the imaging can become are human ingenuity and engineering skills. In a structural MRI, which is a regular MRI, the information is used to examine the physical integrity of the brain, so structural, right, or any other organ being imaged. It also shows the physical brain damage you've sustained, like I talked about the last episode. However, a functional MRI is used to observe blood flow. Since increased cerebral blood flow is tied to increased brain activity, fMRI can show how the brain how the brain calls for resources during a given task. If you're trying to understand the difference between the structural MRI and a functional MRI, in terms of what it means, the article, there's a link in the article, it should help you. However, I hope that this episode's enough, as the introduction to fMRI. I mean, we're not doctors, I'm not a doctor, so I definitely get the imaging and send my psychiatrist or whatever, and see if she can teach me. But she even says she doesn't really know that well, so I'm going to Dr. Amen. There we go. Amen. All right, so for example, we found that patients who have post-concussion syndrome will show telltale signs. What does that mean anyways? Of hyperactivity and hypoactivity in the affected brain regions. Thanks to the fMRI, we're able to pinpoint the post-concussion patients, which areas of the brain are dysfunctional and in what way. So, fMRI can see how the brain is managing its oxygen supply and whether the right regions respond in the right way when given a certain task. So I personally, I'm getting an MRI and the SPECT scan and the CT scan for my brain again, because these Chinese terrorists, they put a chip in my brain, and I had many scholastic journals that I have read, or articles, like real source articles that are accurate or reliable, that it is happening to me. I don't know how, I don't know why, but maybe it has to do with China and Taiwan. Politics, I don't want to get into it. I just want to know what the fuck they put in my brain. That's all. Take care.